Good morning. I'm here with Mark Landwehr with Long-Term Care Solutions in Wichita, and we're going to talk a little bit about the VA aid and attendance benefit. What is the VA aid and attendance benefit, first of all?
Well, really what it is, it's a long-term care benefit for veterans as well as the surviving spouses of veterans. So it's a benefit that can help them pay for whether it's going to be home care, whether it's going to be an assisted living, potentially nursing home. But it really helps take some of the financial burden off of the family as well as themselves due to service that they've earned by World War II, Korean War, or even Vietnam wars who we're working with.
Yeah, that's great because I know I'm familiar with the benefit, and in past years it was only open to like the World War II veterans, and then finally Korea, and now it's all the way up to the Vietnam era. So you did touch on who the benefit is there for: veterans and spouses of veterans that served during those war times, and used to be also. Do they still have to serve in a theater of war during that time frame?
That's a good question, and we get that question a lot. Is they have to have served at least 90 days of active duty service, with at least one being during active war. But you don't necessarily have to have served in theater, which would mean boots on the ground. Vietnam has some different rules, but for the most part, the same rules apply there. Is you didn't have to have necessarily been boots on the ground, and a lot of the veterans we've worked with, they said, well, I'm not eligible because I never left the States. Maybe they were training pilots down in Oklahoma.
Yeah.
Well, the main question we've always asked is, well, when you were talking to your person in charge, did you ever get to tell them what you were going to do, or did the colonel tell you what you were going to do? And we always know which way that answer went.
Yeah. So that's great to know that now that is also something that's opened up. And that benefit pays, roughly how much a month for like a single person?
Sure. Let's say even for a surviving spouse, it's around $1,300 a month.
Wow.
And that's actually tax-free, which is a huge benefit when you really look at it as if the veteran has passed away and at this point their surviving spouse is needing the care. Mm-hmm. Not only is the cost high, but they've also lost the income of their spouse.
Sure.
So that really becomes a huge benefit to try and help them out.
Social Security doesn't, split equally anymore.
Right. Not a whole
When
lot
that
of
happens.
increases at that point.
Yeah.
So it does make a difference being able to have an additional amount of income. And it takes a lot of burden off because as we all know, stress and finances tend to go hand in hand, especially when you start talking about healthcare.
Absolutely. And for a couple, it pays about $2,400 or $20.
Yeah, just under $2,400 a month, and that's also, as you can imagine, that's a huge benefit for someone. Keeping in mind that's tax-free dollars to be able to pay for that care. So, you're not even having a burden of additional taxes.
Sure.
And one of the biggest ones is just the fact that this is an earned benefit. So it's not a handout, if you will. It's designed a lot for the middle class, which is a really unique benefit, as we all know.
Yes.
When we start talking about benefits, whether it's Medicare, Medicaid, VA, any of those kinds of benefits. So it really is designed to help those in the middle class be able to afford that care, and hopefully not have to run out of all the assets they earned over that time.
Because we all know that any kind of care in a senior community is expensive. Very expensive, we know. And so any benefits that we can provide for our seniors, and especially those that have served us through the military, go for it. I'm a very big advocate for that. So there are, I'm assuming, limitations, though, on what will allow you to qualify for this benefit.
Sure. So the VAs, they also have some income limits where we're going to be looking at what's your unreimbursed medical expenses minus, or your income minus your unreimbursed medical expenses. The VA is also going to have some different asset limits to where not a matter of, well, I've got too many in assets to get it, but what they may have is it's a 3-year look back. So we may have to do some sort of financial planning, even some estate planning, mm-hmm. which is why we have VA accredited attorneys that are part of our group as well, to where we can help out and navigate the VA. And then frankly, it's knowing what the rules are, because this is a benefit that was earned. And I found out about this benefit about 16, 17 years ago because my grandfather was a World War II veteran, and we got this benefit from my grandmother. And I can tell you for sure there's no way she would have gotten it without myself, as well as my father, is who I also work with. We had to learn the benefit many years ago just so we could help others, and frankly that's why we do it today, because it helped our family so much. We figured, well, this is really up our alley as far as knowledge and understanding of the finance of healthcare. We thought, well, we need to expand this and help others.
Yeah, it is such a great benefit, and the process is not an easy process to go through. A lot of people will approach me and say, oh, well, I'm going to take care of doing this on my own. I don't advise it at all, because everyone that has done that I have worked with, it could be 2 years down the line, we're still waiting on trying to get that benefit even pushed through. We all know what government red tape is, and different kinds of forms through federal filing of taxes or whatever. We've all experienced it. It's not something you should undertake on your own. I highly recommend utilizing the services of Mark and David. But so talking about that, about how long does it take to get the benefit now?
Sure, it varies quite a bit, and sometimes it depends, is the VA in the news or not. And what we do find, it can take up to 6 months, and in some cases longer once we've actually filed the benefit. What we do find is you really, if at all possible, you frankly want to start doing some of the planning before your health is changed, perhaps maybe at the beginnings of home care, or when you got to admit at some point I may need some care, or even my spouse may start needing some care, because there could be a 3-year waiting period before we can actually file and get the benefit. But once we've filed a case, we tend to find around 6 months. But at the same point, depending on the year, we've been doing this for quite a while. We've seen some cases take a little bit longer, and we've seen some a little bit shorter. Yeah. But an average is around 6 months is what we've found.
And there are also some qualifications as far as just because you move to a senior community or you start receiving some assistance at home, that doesn't mean that you will qualify for it right away either. We'll talk a little bit about the activities of daily living and the certain qualifications that they have to meet for that.
Sure. So they've made changes in the last couple of years as far as qualifying. It used to be a matter of saying, well, do you need the regular aid and attendance of another person, which is where that phrase aid and attendance has come from. But at this point, they're looking at more traditional healthcare terms, which are activities of daily living, like Shelley had mentioned. So things like dressing, bathing, transfer incontinence, dementia, so any sort of cognitive issues if someone's been diagnosed. Those are going to be things at that point you'd be able to trigger the benefit, but you've got to have at least 2 of the activities of daily living or have a cognitive issue, and that's one of the health qualifications that you'd have to look at. Because as Shelley was mentioning, it's not just one thing. The VA's got many different rules that we have to navigate, and that's how we do a lot of that just one-on-one. There's no cost for a consultation to sit down with us, and because that's one of the big questions we get. Hey Mark, how much is this going to cost me just to sit down and talk? There is no cost to sit down and talk. You guys decide if this is of benefit or of value. And we have cases where now's the time to we have to get something moving. We don't like crisis situations, but we're going to be here for you in that mode as well. We prefer, if at all possible, to get some of that planning done. And an important piece of this is make sure you've got your kids involved. They need to know what's going on, especially if your health changed. Well, which kid is going to be the one helping with the finance? Who's helping with the health care side of it? Is one going to be taking on all of that burden? Right. We call that the discussion, because we all are going to have that with our children at some point, and it's better to get your wishes out there to your family earlier on so that they're not trying to scramble through, well, what's this financial record? Where did this come from? Well, hey, Mom, Dad, did you want to stay home? or were you wanting to look at, say, Reflection Ridge, where you're
Mm-hmm.
wanting to come into one of these places, maybe you can get a little home care there, so you're not having to deal with the lawn and
Yes, exactly. And that's a great point. Getting a child or another family member or a very trusted friend involved in these discussions, and so they understand what's going on, what you have lined up for even prior to needing services or going to a community or whatever the case may be. Because what if something happens? We run into those scenarios where, oh my gosh, you've had a fall or a stroke or a heart problem, and no longer are you safe to be at home, and so you're forced to go into a situation where you need healthcare support or a community. And then what do? You may not be able to voice what your plans were at that time, or even have had a plan in place. And so having these things taken care of as far ahead as you can are a great benefit. The process for filing for your benefits. Walk us through kind of what does that look like? What do we need to bring with us, and what
Sure.
should we expect?
So the just kind of starting out, what you'd find is my assistant Kathy would actually send out what we call our homework sheet. It's just fill in the blank. We've got to know, what's your income. We call that kind of your mailbox money. You've got maybe Social Security coming in. Some still have pensions coming in, even though those are going away as we keep coming down the line. And then also we're going to look, if you've currently got some additional medical expenses, maybe you're needing care currently, so we're going to want to know what that is. And then we're also going to look at assets. So, is it a value of a home? Some have rental properties. Is it IRAs? Whatever it is. Some have it in CDs. Everyone lived their life a little bit different.
Right.
And that's why we've also got a team that can help analyze. And once again, there's no cost or fee associated with the consultation, and see if it makes sense. But we've put professionals together, from whether it's real estate, whether it's oil and gas, and I am not an oil and gas guy, so we have some professionals on that. And so what we would do is we would do a full assessment and really crunch and look at all the numbers and get to understand yourself. I call this is kind of brushstrokes on a canvas. We're trying to paint your picture so we can understand fully, well, what is needed for you, what are your wishes, who are the ones involved, which kids. You have some kids there in Delaware, and then you got one here.
Yeah.
Well, we know who we're probably working with the most, but we can also connect, just like technology that we're using here today. We can get everyone connected so everyone knows what's going on, but we really want to understand what are your wishes as the veteran or as the surviving spouse of a veteran. That's really our client. It's not the kids that we're working with primarily. They've got to know and they've got to be involved in it.
Right.
But our client is definitely the veteran. We're very honored to be able to work with them. So at that point, we would do an assessment, and from there we'd be able to gauge, well, what do we need to do? Is there some estate planning that's going to be necessary? Is there some financial sides that we need to be looking at? Because, well, we've gone into different modes, right? When we were looking at finance at 30,
Yes.
that was one, and then at 40 or 50, that was a whole other animal. And, well, frankly, now at this point, healthcare needs and healthcare costs become something we've got to be able to protect. We can't afford to be losing
Right.
all these and taking these big hits. I mean, we're dealing with a lot of those big hits right now.
Oh,
And
absolutely.
we've had people talking to us going, gosh, if I would have done this 3 years ago, 2 years ago, this wouldn't have been an issue here. But, we are where we are. And
Right.
so at that point, once we've completed all that assessment, we've come up with a plan that you're comfortable with. Then we would decide, well, depending on what all the VA rules are, where do those apply? Can we file now? Or are we just setting things up, which is hopefully we're doing a pre-planning situation to where in potentially 3 years, because I'm hoping we're catching it a little earlier, then in 3 years we'll also be there to help get the case filed and move along for that side as well.
Absolutely. And that's a great point. You're also not just here for the initial consultation and this is what we're going to do. We're going to get filed for you and see ya.
Right.
They're not there. They're here in the long haul, even after the benefit is filed, to work with you and make sure that everything is taken care of and your family is taken care of. And you have said it doesn't cost anything to file for the benefit. This is something that is provided, it's something that's earned, and you guys provide that consultation. Now, there may be some costs involved, though, if you're
Right.
looking at.
Yeah, if you're needing to do some of the estate planning, or if there's some financial stuff on that, it's typical. If we could find an attorney that would work for nothing, we searched, but it's one of those. I don't think I would have used that guy.
Yes, exactly.
But that's all something that's up front. It's your decision. We're not a pushy group. I've got agents all across the country, so it's not just myself. I train other agents from Georgia to Colorado to West Virginia and heck, Wisconsin. So we're all over the place on that. But I'm based here in Wichita, so the head of our company is frankly born and raised. I'm
Yes.
right here. I've been here. I've traveled all over, but I love Wichita. But we've got others that are really great professionals as a part of our group. So it's not just a one-man shop. You have some out there that they're just pushing the one thing that will help them out. Well, I don't need that. We've got professionals in different avenues that, even heaven forbid, the question I've had before is, well, Mark, what if something happens to you? Where am I at in 3 years, right? And that's why we put a team together, so that way it's not, well, you're high and dry at that point. No, I've got about 9 agents just here in Wichita. So, well, if something's going on with all of us, then
We're all in trouble anyway. Well, thank you so much for your time. I appreciate all the great information. And how can folks get a hold of you, Mark?
Sure. So a good way to do that, and I'll give you a couple of numbers, is my assistant Kathy, which she's actually the one that sends out the homework sheet and gets this initial consultation started, and is going to be 316-733-1820, and that's Kathy. I kind of wake up and do what she tells me in the morning because she runs my schedule there. But if I can answer any questions as well, my number is 316-214-1864. And that's my direct number if you have some questions for me.
Thank you so much. Appreciate your time. And reach out to Long-Term Care Solutions. They can help you with a lot of different things, but especially this VA aid and attendance benefit. Thanks for your time. Have a good day.